St. Damiano Mission Hospital was established in 1999 as a small dispensary by the Little Sisters of St. Francis, and today it is still under the management of the same congregation. The hospital has grown gradually and it has scaled up to level 4 with a bed capacity of 80 under the Kenya Essential Package for Health. We receive most of the patients who cannot afford care, but we assist them accordingly. And we are privileged to be within the town. Actually, it is located along Bungoma Mumias Road, exactly 50 meters from the road. So our patient can access the services very fast, regardless of the means they are using, walking by foot, using boda or using a vehicle. The place is well accessible.
We treat, God heals.
The hospital is licensed by all the bodies required: the medical board, the laboratory board, a radiology department, the dentists department, and pharmacy.
As a level 4, that means a referral center. We receive patients from both within and outside the county. So we have both inpatient and outpatient services.
We do immunization, we do VCT, counseling and testing of HIV. We have comprehensive TB and the CCC clinic for people living with HIV. We do outreach services for hypertension and HHA program.
Also, other services that we do in our facility, which is quite important in our treatment as doctors, are lab services and imaging centers. You realize part of making a diagnosis, you really have to have a good investigation panel. And we are glad that our lab is now well equipped. We are doing a number of tests. We can do liver function tests. We can do renal function tests. We are doing hormonal profiles like the thyroid function test and that all. So all these are services that not so many level 4 facilities around have them, but we are privileged that as a facility we can really maximize in our investigation and providing appropriate care for our patients.
I'm Elias Wafula, the lab in charge St. Damiano. Our main objective is to produce the quality results within the stipulated time, that is the TAT. We are doing the routine laboratory tests, we are doing the special tests. Within the special tests, we have the renal functioning tests. We are doing all the functions of the kidney. We are doing like the immunoassays. So kindly visit us in terms of any requests that we may be involved in. We have traveled all along. We started within a small room. Right now we are in a spacious place. We have the capable machines that are within, and they have been approved by the government and the KMLTTB. We have our capable phlebogram analyzer, that is the hematology analyzer. It's 5-part that runs all the required hematology indices. We have 2 stable electronic microscopes that they are working hand in hand. This one is 100% working, the same is 100% working. The services are up to date, so they pass the QC. Okay, this is our blood bank. We have blood inside it. We have constant blood here with us. This is our electrolyte machine. It has chloride, sodium, and potassium. This is our immunoassay machine, chemistry machine. It has the thyroid functioning test, HbA1c, and it has the PSA. We have our big machine here, the chemistry analyzer, the fully automated, that it carries like 34 tests. Here we do both renal functioning tests and liver functioning tests. All enzymes of the liver are done using these machines.
Our services are well stipulated and our clients admire and they give us good comments. Actually, among the services we offer, we are the best in the county and we really appreciate our clients.
Mimi naitwa Dismas Paul Nyongesa, mkaaji wa Bumula sub-county. Kitu mzuri kwa hii hospitali is the hospitality, the human element. Wako na udamu wa kukaribisha hata ukiwa mgonjwa, wanakukaribisha vizuri, wanakufanyia hiyo mambo na nataka, wanakufanyia services vizuri. Sasa kama mimi saa hii ni kama hii ni nyumbani.
At St. Damiano, being a mission hospital, our prices are very affordable and we also offer quality care to our clients. For our corporate clients, we have also set for them a private wing so that they can be treated at a convenient comfort. For those our corporate clients which have not read in the list, we have not left you out. We are trying our best to bring you on board so that you can get treatment at St. Damiano Mission Hospital.
We do not discriminate any patient due to denomination or race. We are here for them. And we admit even Muslims, both Christian and Muslims and other denominations.
Mimi kwa majina naitwa Hairia Mohamed, ni mkaaji wa Bungoma. Nimependa hii hospitali sababu hii ndio hospitali iko karibu na mimi, alafu pia niliipenda mazingira. Na kuanzia nikuje mabadiliko iko. Sasa inaendelea vizuri, hata nashukuru, na pengine kesho naweza toka.
We treat, God heals.
We have theater services and currently we have 4 theaters, 3 major theaters and the 4th one is a maternity theater. We have the biggest theater in this county and we appreciate that. And we work in conjunction with the county and other hospitals around. They refer her patients to us.
This is a main operating theater where I do both the general surgery, obstetrical surgery, but we are moving to the other side where we are doing only obstetrical surgery. We also do orthopedic surgery. We do ophthalmology surgery in the other theater where there is no light. If you have seen the theaters where everywhere is covered with the windows are covered with the black curtains, that is the theater for ophthalmology surgery. Usually ophthalmology surgery is done in darkness. That's when the surgeon is able to see when he's operating the eyes. It's one of the best theaters in this town. As you can see, it's well equipped, spacious, and it comprises of the reception, the recovery room. It is a theater that is well designed. We have modern machines that are giving us a very optimal care during surgery. In a month, we do major surgeries or almost up to 62 patients. But the number goes high, especially when there is a crisis at the county general hospital. We can go up to even 200 cases in a month. That's when we are actually very busy. Otherwise, our average is around 60, 62 patients in a month.
Also in our imaging centers, we realized that we can able to do things like x-rays, ultrasounds, and just like the laboratory, these ones are crucial in our diagnosis. We realized that when you're handling mothers from the maternity area, you need ultrasounds. When you have surgical cases like obstructions, you need things like x-rays. So I believe that our facility, we offer these services quite well.
I'm Cecilia Apalat, HOD Radiology Department. Here we are doing x-ray, we have ultrasound, doing all the ultrasonic procedures. And our x-ray is a digital CR. We do almost all the procedures. And we manage all the conditions as per concerning the radiology department, and we do it as per the request and we do it appropriately. For our patients, they normally like our services, and when they need any clarification or any attention, we give to them, and most of them, they are alert, and most of them like them.
This is our physiotherapy department. Actually, physiotherapy involves diagnosis, treatment, and rehabilitation of patients with musculoskeletal injuries. Apart from that, it also involves cryotherapy. That is where we use ice in the management of acute conditions. It involves soft tissue manipulation, where we have sometimes we use machines or you can use the hands. We also have electrotherapy, where we use electricity in the treatment of patient. An example is TENS, that is transcutaneous electrical nerve stimulation, to stimulate the nerves. In the course of rehabilitation, you can get a patient, let's say an amputee, and then you need to train them to go back to their daily activities. So we train them. I have a walking frame. I train them how to walk. I have also a Swiss ball for therapeutic exercises. I do for exercises of the back, and in cases of children with cerebral palsy. And then I also have an ergometer here for the thigh muscles and the back muscles. And then apart from that, you also have, I use firm liniment for, it has therapeutic effect in relaxation of the muscles, and then it will also help to manage the condition of the patient.
Of course, we are guided by values as faith-based organization, which are the love of Christ, committed to Catholic health ethics. We are honest and we uphold integrity. We practice professionalism and confidentiality, which is very key for our patients. Our objectives are to offer quality and holistic health care to our clients, to support the less privileged members of the community, to reach the marginalized people with compassion, to empower the employees through capacity building, and to become the preferred healthcare provider in Bungoma County and the country at large, to build the broken community with love and care.
Our dental unit is the best in town because of our cooperation with Dentists for Africa. It's an organization started in Germany, based in Germany, which supports people who cannot afford this good dental health care. So they support us with supplies. We have their instruments here. They bring for us things which can't even find here in Kenya. So they want this clinic to be like operating the way they operate in Germany. So they supply us with everything, and we work in cooperation with them. Even if I treated 2 people and I have done the best, I'm like, okay, they have left, they are smiling because the teeth that were broken are now restored, and I am satisfied. So you will give us the money. Of course, it's not comparable with what others are charging, but we'll do for you the best. Like, we are somehow self-reliant, that we are not going to theater to sterilize. We do our things here. And it's all courtesy of these people called Dentists for Africa. They make things easy for us here.
The good thing with our pharmacy is that it's well stocked. We have variety of medical commodities and drugs that can meet majority of our patients' needs. Our major supply is meds. That's where we get most of our drugs, because they have a quality lab. So we are sure of the quality medications that they are supplying to us.
In maternity, we have free maternity package, whereby a mother walks in and out from the hospital under Linda Mama program, which is under NHIF. On the same note, we also offer free ambulance services. We pick our mothers from the community, especially at night, since the COVID-19 started. Now they cannot travel at night. We also have a very good newborn unit, which is operational.
This is our maternity wing. In this maternity, we have a labor ward with 3 delivery beds where mothers deliver from. We have the antenatal ward where we admit mothers with antenatal cases and those mothers who are in the first stage of labor before we move them to the labor ward. We also have the postnatal ward, post-delivery mothers, whether they've delivered normally or by cesarean section. We have the ward where we admit them from. Then in the same department, we have the theatre, that is the maternity theatre. So our mothers who are going to deliver by cesarean section, we just do the operation from within the maternity department.
Basically, we do inpatient and outpatient as well. Maternity outpatient, we have ANC. We treat patients, expectant mothers from the ANC during delivery and also post-delivery.
And in the same maternity department, we work as a team. There is a team of midwife nurses, we have clinical officers, and we have the medical officers. All services are in a package. So when you enter here, you find everything wholesomely. We welcome all of you to come and enjoy the services that we offer in St. Damiano Maternity Wing.
Nilizaa mtoto, ikabidi wamweke nursery na immediately akawekwa. Madaktari pia waliharakisha wakaanza kumhudumia. Sasa naona change iko na huduma hapa ni mzuri sana. Madaktari wanakuelezea pamoja na masista wako social, kama hujui kitu anakuelezea. Huduma yao iko sawa. Wamama wengine wenzangu huko nje wakipata shida kama hii yangu wasikuwe na hofu, wakimbie tu St. Damiano. Hata mimi nilikuwa nasikia tu, lakini nilifika huku na nimehudumiwa vizuri sana. Mtoto wangu ako hai.
Vile nililetwa hapa nilikuwa nimepumua, yani nilikuwa nimepumua sana. Wakachukua fursa kwa kunisaidia kwa harakati, wakasema ya kwamba tutakupeleka theater ili maisha yako ya survive na uwe mzima.
At the Damiano Mission Hospital, once we receive corporate clients and NHIF clients, we check the authenticity of their cards, and once we are satisfied with their cards, we send them to the clinicians who offer services to our clients. And those clients who have issues with their cards like NHIF registration, biometric registration, payment of monthly premium, and also registration of the dependent, we advise them on how to handle their issues, and where possible we also help them to handle at their own comfort. We also offer maternity services and NHIF, whereby our clients benefit from ambulance services at free of charge under Linda Mama program and also NHIF program.
In our facility, we don't do family planning. We encourage a natural method of family planning. So things like implants, intrauterine devices, we don't do that.
St. Damiano is privileged to have 4 staff trained and qualified to offer natural family planning that we offer to our clients. And those who request for other services, we as well connect with the county.
My name is Olumbe Vidija Eli. I'm a Human Resource Officer, St. Damiano Mission Hospital. We are here to make sure that we have the qualified staff to work with us, where we begin from the word go of advertisement. Then with the way we recruit our staff, we make sure that we have the qualified personnel skills. That's in terms of knowledge, in terms of skills, in terms of attitude, so that we integrate them with our culture, that we make sure that it is here to make our facility to grow the way we want. After we have find the right candidate for the position, we make sure that we take the candidate through a process of induction where we are making them to familiarize themselves with the facility. This includes giving them our values, our missions, and our goals where we want to be in the next years to come. After that one, we take them through to the immediate managers where they can get mentorship on how we want them to act while they are performing their respective duties.
I work as an optometrist. In our department, we deal with eye conditions such as cataract, refractions, and management. Most of the work we do is to improve the vision of our clients. We do surgeries. We have a well-equipped theater. In our department, we also have refraction where we dispense glasses to our clients and give treatment like eye drops so that we can improve their vision.
We do performance appraisal annually, and for those staff who are doing well, we motivate them so that we keep this standard of the facility at a high stake. Our main goal and our main objective at this office is to make the St. Damiano facility as an employer of choice, so that every talented, every experienced, and every knowledgeable employees who want to work with us will be attracted to this facility because of what we have put down to attract more talented employees.
We experience the spiritual nourishment as a hospital. We have masses every month, the last Monday of the month at 8 in the morning. When we have a patient who needs to be counseled spiritually, we liaise with the Father. When we have Christians who need anointing, who needs to be to receive communion, we have a very good relationship with our priest, and we call them and they offer the services. As staff, we meet and pray every morning. We read the Bible, pray together as a family, and share as we distribute our duties in the morning.
I'm Sister Claire Mukopi, a clinical nutritionist in St. Damiano Mission Hospital. This is a department that currently is stable. We are 3 of us, and in this department, every patient that walks in and out of the hospital, we ensure that the patient is subjected to nutrition care process, and that entails nutrition assessment, nutrition diagnosis, nutrition management, and follow-up. Most of the non-communicable diseases are related to nutrition, which is poorly done. So as St. Damiano Mission Hospital, we are interested that every patient who comes in this hospital, the nutrition intervention is well done, and as they walk out of the hospital, we also follow up to ensure that our patients are doing well. And this is seen in our nutrition clinic, especially in diabetes and hypertension clinic, which is run on a monthly basis. And as I speak today, our patients are doing very well, and that is my achievement, and I'm really happy about it. And so we encourage our patients, whether those who are in good health or sick, always to follow up, at least to see a nutritionist twice a year, and if possible, they come in this hospital so that we help them. As I assess the situation in St. Damiano, I can say that nutrition service is very outstanding. Why? Because we don't allow any patient with non-communicable disease or any disease that is related to nutrition or what food can affect that particular patient to march out of the hospital. And that is our joy to see that our patients are doing well.
Kwa majina naitwa Damiano Hospital wa Nyama Kotoi. Mahali penye niko hapa nachandaa sapa yangu Inapofika saa 11 kamili lunch yangu sapi itakuwa tayari. Takana mgonjwa akule kwa masaa. Na anapokula kwa masaa atashukuru amekula chakula yenye iko moto. Sasa wai takane tuchelewe sapa yetu. Nafanyanga tukiendelea kwa masaa. Na chakula inapokuiva tunajipanga mwenye atasafu chakula. Nasaitiana kupanga kwa tray kila kitu inatakana, tufunike waiter na hapo kupeleka chakula kwa mgonjwa apepe vile inatakana, isifike mahali pengine chams hapo tembe kwa hospitali sinaweza patikana.
The administration of St. Damiano Mission Hospital since its inception has been as follows. Our patients, we are happy to receive you frequently. We offer 24 hours services in all the departments, and we welcome you day and night so that you can experience our love and care.
For general inquiries, get in touch with us on 0748 196 069 or 0723 691 519. Follow us on our official social media handles for important updates. Facebook at SD Damiano Mission Hospital, Bungoma. Twitter at SD Damiano BGM. Instagram SD Damiano Bungoma. You can also visit our website at www.stdamianohospital.or.ke.
Nashukuru sana St. Damiano Mission Hospital of Bungoma.
Welcome to St. Damiano Mission Hospital. We treat, God heals.